Hello to everyone. Today we're going to talk about coronavirus. As everybody knows, the coronavirus has been one of the greatest pandemics around the world in the modern time. The countries that have been more affected by this virus are China, Italy, and more recently, United States. So, thanks for your attention.
If you develop fever, cough, and difficulty breathing, seek medical advice promptly, as this may be due to a respiratory infection or other serious condition. Call in advance and tell your provider of any recent travel or contact with travelers. Why? Call in advance with alert your healthcare provider to quickly direct you to the right health facility. This will also help to prevent possible spread of COVID-19 and other viruses.
What is COVID 19? COVID 19 is an infectious disease caused by the most recently coronavirus, but the new virus and disease were unknown prior to the outbreak in Wuhan, China in December 2019. The most common symptoms of COVID 19 are fever, tiredness, and dry cough. About 1 in 6 people who contract COVID 19 develop a serious illness and have difficult breathing.
As we could see in the previous presentations, there were things that should not be done in the effective presentations, starting with pics outside of the context of the topic, continuing with reading and not seeing the public, finally placing many words and slide per slide and saying incorrect information.
Well, the things that my partners did, that is all wrong, and the things that you must do to make a good presentation is only 30 words per slide, use images, and then explain in the presentation, because it's better for the public, because it's more dynamic, and they will give more attention to that if you use the things that you must do, and that's it.